Sandile St. Benedict Khumalo has been living with HIV for 20 years. The AIDS activist contracted COVID-19 earlier this year, not long after receiving his jab.
I didn't have a headache, I didn't have the strong cough, It was little bit of changes in terms of the voice. I thought maybe I catch the flu because the season is changing, But it wasn't something severe.
Khumalo believes being vaccinated and being diligent with his anti-retroviral therapy helped him escape the severe effects of the coronavirus.
My line of the treatment is one of the strongest line of the treatment, of which is the first line regimen, of which is combined of equivalence, and I strongly believe in my treatment combination that the 3CC helped me a lot, in terms of to try to push back COVID.
At least 4% of people in Khumalo's shoes have defaulted on their treatment. Almost 4 million South Africans, half of all HIV-positive people, were on antiretrovirals before the pandemic. Scientists are concerned a drop in numbers puts patients at a higher risk of severe COVID-19 infection.
The long duration of this pandemic has affected people's ability to get antiretroviral therapy in some cases. And because of that, when we do see them have COVID, the outcomes are somewhat worse. So they require, for example, more supplemental oxygen than people who are either suppressed or people who are HIV negative.
Close to 22 million people have so far received at least one jab, but it's not clear how many HIV-positive people have been vaccinated so far.
The quicker you can get vaccinated, the better it will be. And people who may have challenges with antiretroviral therapy and getting the therapy may also have challenges coming in for vaccination. So certainly, from the public health perspective, people that live with HIV and have these issues need to be prioritized.
The challenge for South Africa is protecting those who are at risk. 11 million people, which is almost 20% of the population, have so far been fully vaccinated, but it's still taking time to reach the elderly in remote places. Julie Shara, CGTN, Cape Town, South Africa.